This research study looked into the association of electronic wearable device use and physical activity recommendations in cancer survivors. In terms of cancer survivorship, it is estimated that by 2030, the number of cancer survivors in the United States will increase by 32%, which is an estimated 22.1 million cancer survivors. Physical activity is associated with a lower risk of death and cancer reoccurrence, especially for survivors with breast and colorectal cancer. The American Cancer Society recommends at least 150 minutes of moderate to vigorous physical activity per week. However, only 20 to 30% of cancer survivors have been seen to be physically active. Because of this low percentage, it is important to understand how tools such as electronic wearable devices could be used to promote physical activity in cancer survivors. Previous research that was conducted in the general population in 2019 indicated that electronic wearable devices, EWDs, are associated with increased physical activity. Examples of EWDs are Apple Watches, Fitbits, and so on. Cancer survivors who meet the physical activity guidelines have been seen to have better health outcomes, and EWDs could be a useful tool in helping cancer survivors keep track of their physical activity. The purpose of this study was to investigate the association between meeting physical activity guidelines, electronic wearable device (EWD) use, and health-related factors in cancer survivors. This study was a secondary data analysis from collecting data from 2020 HINTS 5 Cycle 4 from February through June 2020. HINTS stands for the Health Information National Trend Survey, which is a cross-sectional survey of a nationally representative sample of Americans age 18 and older. A total of 3,865 completed surveys were collected with a response rate of 37%. This included those diagnosed with cancer and was assessed in the survey with the question, "Have you ever been diagnosed with cancer, yes or no?" In this study, we included participants who checked yes to this answer. Of our sample, 41% were males and 59% were females. Additionally, only 197 participants were working full-time compared to 422 not working full-time. Self-reported weekly minutes of moderate physical activity were used to categorize cancer survivors as not meeting or meeting physical activity guidelines as set by the American Cancer Society. Thus, those that spent less than 150 minutes of physical activity per week were not meeting the guidelines, whereas those that spent greater than or equal to 150 minutes of physical activity per week were. EWD use was assessed by cancer survivors who answered yes to the question, "In the last 12 months, have you used an electronic wearable device to monitor or track your health or activity?" Pearson correlation was then run to examine correlation between EWD use and meeting physical activity guidelines. In addition, multiple logistic regression analyses was run to determine the associations between physical activity guidelines, EWD use, and health-related factors. These health-related factors included general health, time strength training, average sitting time, and rating of general health. The results showed that only 34% of cancer survivors were meeting moderate physical activity guidelines. Thus, 66% of cancer survivors were not meeting the guidelines. A significant correlation was also found between EWD use and meeting physical activity guidelines. In fact, EWD users were around 2 times more likely to meet physical activity guidelines. In addition, cancer survivors who participated in strength training were 1.3 times more likely to meet physical activity guidelines. And then finally, cancer survivors who spent more time sitting were seen to be 1 time more likely to not meet the physical activity guidelines. This study found that only 34% of cancer survivors were physically active, which is similar to past research that found between 20 to 30%. It also found a relationship between EWD use and meeting physical activity guidelines, specifically in cancer survivors, which built on previous research in the general population. In terms of health-related factors, only strength training and time spent sitting were associated with physical activity. Therefore, EWDs may be a useful tool for physical activity promotion in cancer survivors and is worth further exploration. A limitation for the study was that the data was collected in a cross-sectional manner using self-reporting. Self-reporting has limitations. For example, cancer survivors may be stating that they are meeting the physical activity guidelines when perhaps they are not. In addition, using HINTS data limited the variables included in this study. For example, we could only use EWD use in the past year when perhaps a shorter time frame would have been better. Furthermore, we only included cancer survivors in our analysis, so results should not be generalized to other populations. A focus of future research could point toward integration of behavioral strategies with existing EWD users to promote physical activity. And these are my references that I used throughout my presentation. Please let me know what questions you have for me.